Welcome viewers. Today we are talking about pericardial effusion. Pericardial effusion often accompanies pericarditis. We all know it and can have a number of causes. Now, clinical features. With the onset of an effusion, the heart sounds may become quieter and the friction rub, if present, may diminish in intensity. What is this? As the onset of an effusion, the heart sounds may become quieter and the friction rub, if it was present, may diminish in intensity but is not always abolished. Large effusion may be accompanied by a sensation of retrosternal operation. While most effusions do not have significant hemodynamic effects, large or rapidly developing effusions may cause cardiac tamponade. So, large or rapidly developing effusions may cause cardiac tamponade. This term is used to describe acute heart failure due to compression of the heart, and is described in detail below. Typical physical examinations. Typical physical examinations findings are markedly raised JBP, hypotension, pulsus paradoxus, and oliguria. So what can we find? We find a markedly raised JBP, we will find hypotension, pulsus paradoxus, and oliguria. Atypical presentations may occur when the effusion is loculated as a result of previous pericarditis or cardiac surgery. Now, the investigation. Echocardiography is the definitive investigation. It is helpful in monitoring the size of the effusion, and its effect on cardiac function. The QRS voltages on the ECG. Are often reduced in the presence of a large effusion. The QRS complexes may alternate in amplitude due to a to and fro motion of the heart within the fluid-filled pericardial sac, which is called electrical alternance. The chest X-ray may show an increase in size of the cardiac silhouette, and when there is a large effusion, this has a globular appearance. What is the appearance? Globular appearance. Aspiration of the effusion may be required for diagnostic purposes, and if necessary for treatment of large effusions, as described below. This is an echocardiography. It is taken from apical view, from apex of the heart, and short axis view of the heart showing a large circumferential pericardial effusion. The arrow, the black area, and LV indicates left ventricle. Now, the management. Patients with large effusions that are causing hemodynamic compromise or cardiac tamponade should undergo aspiration of the effusion. This involves inserting a needle under echocardiographic guidance medial to the cardiac apex or below the xiphoid process, directed upwards towards the left shoulder. The direction will be upwards towards the left shoulder. The route of choice will depend on the experience of the operator, the shape of the patient, and the position of the effusion. A pericardial drain may be placed to provide symptomatic relief. Complications of pericardiocentesis include arrhythmias, damage to a coronary artery, and bleeding. What are the complications of pericarditis? The complications of pericarditis are arrhythmias, damage of a coronary artery, and bleeding, with exacerbation of tamponade as a result of injury to the right ventricle. When tamponade is due to cardiac rupture or aortic dissection, pericardial aspiration may precipitate further potentially fatal bleeding. So it is an important line which says when tamponade is due to cardiac rupture or aortic dissection, pericardial aspiration may precipitate further potentially fatal bleeding, and in these situations emergency surgery is the treatment of choice. A viscous, loculated or recurrent effusion may also require formal surgical drainage. Thank you all.